For seniors, nutrition plays a critical role in maintaining health, energy, and longevity. As we age, our bodies process foods differently, and some foods that seem harmless can pose serious risks. On the other hand, certain nutrient-dense superfoods can significantly boost vitality and well-being. Today, we'll explore 3 foods seniors must avoid to protect their health and 3 superfoods they should incorporate into their diets to thrive. Let's dive in. First, let's talk about the foods seniors should steer clear of. Number 1, processed meats. Think bacon, sausages, hot dogs, and deli meats like ham or salami. These foods are often loaded with sodium, preservatives like nitrates, and unhealthy fats. High sodium levels can spike blood pressure, which is a major concern for seniors. As hypertension increases the risk of heart disease and stroke. Nitrates, used to preserve color and flavor, have been linked to an increased risk of certain cancers, particularly colorectal cancer. The saturated fats in processed meats can also raise LDL cholesterol, clogging arteries over time. A 2020 study published in the American Journal of Clinical Nutrition found that high consumption of processed meats was associated with a 15% higher risk of cardiovascular disease in adults over 60. For seniors, even small portions can have outsized effects. Instead of processed meats, opt for lean proteins like grilled chicken, turkey, or plant-based options like lentils. The second food to avoid is sugary beverages. This includes sodas, sweetened iced teas, energy drinks, and even some fruit juices that are more sugar than fruit. These drinks are a major source of empty calories, contributing to weight gain and increasing the risk of type 2 diabetes, which is already a concern for many seniors. The high fructose content in these beverages can also lead to fatty liver disease and insulin resistance. A 2019 study in the Journal of Gerontology showed that seniors who consumed more than 2 sugary drinks per day had a 20% higher risk of developing metabolic syndrome, a cluster of conditions that includes high blood sugar, high blood pressure, and abnormal cholesterol levels. Beyond that, sugary drinks can exacerbate inflammation, which is linked to arthritis and other age-related conditions. Water, herbal teas, or unsweetened green tea are far better choices to stay hydrated and support overall health. The third food seniors should skip is refined white flour products like white bread, pastries, and many packaged snacks. These foods are stripped of fiber and nutrients during processing, causing rapid blood sugar spikes. For seniors, this can strain the pancreas and increase the risk of insulin resistance or diabetes. The lack of fiber also means these foods don't support healthy digestion, which can lead to constipation, a common issue for older adults. A 2021 study in the Journal of Nutrition found that seniors who consumed high amounts of refined grains had a 25% higher risk of developing cardiovascular issues compared to those who ate whole grains. Refined flour products also tend to be low in essential nutrients like magnesium and B vitamins, which are critical for energy and brain health. Swap white bread for whole grain options and choose snacks like nuts or fresh fruit instead of pastries. Now, let's shift to the good stuff. 3 superfoods seniors should embrace to boost their health. First up, leafy greens like spinach, kale, and Swiss chard. These vegetables are packed with vitamins A, C, and K, as well as folate and antioxidants. Vitamin K in particular is essential for bone health, helping to prevent osteoporosis, which affects 1 in 3 women and 1 in 5 men over 50. Leafy greens are also rich in fiber, which supports digestion and help us regulate blood sugar. The antioxidants in greens like lutein and zeaxanthin protect eye health, reducing the risk of age-related macular degeneration, a leading cause of blindness in seniors. A 2018 study in the British Journal of Ophthalmology found that seniors who ate leafy greens daily had a 40% lower risk of macular degeneration. Try adding a handful of spinach to smoothies, tossing kale into soups, or sautéing Swiss chard with garlic for a nutrient-packed side dish. The second superfood is fatty fish, such as salmon, mackerel, or sardines. These fish are rich in omega-3 fatty acids, which are powerhouse nutrients for heart and brain health. Omega-3s reduce inflammation, lower triglyceride levels, and help prevent arrhythmias, which are irregular heartbeats that can be dangerous for seniors. A 2022 study in the Journal of the American Heart Association found that seniors who ate fatty fish twice a week had a 30% lower risk of heart attack or stroke. Omega-3s also support cognitive function, potentially slowing the progression of age-related cognitive decline. Fatty fish are also a great source of vitamin D, which many seniors are deficient in, and this vitamin is crucial for bone health and immune function. If you're not a fan of fish, consider a high-quality fish oil supplement after consulting your doctor. But eating whole fish is the best way to get these benefits. Grill some salmon with lemon and herbs, or add sardines to a salad for a quick, healthy meal. The third superfood seniors should eat is berries. Blueberries, strawberries, or raspberries. These vibrant fruits are loaded with antioxidants, particularly anthocyanins, which combat oxidative stress and inflammation. Oxidative stress accelerates aging and contributes to chronic diseases like cancer and Alzheimer's. A 2020 study in the Journal of Alzheimer's Disease found that seniors who ate berries regularly had a 35% lower risk of cognitive decline. Berries are also high in fiber, which aids digestion, and they have a low glycemic index, meaning they won't spike blood sugar like sugary snacks. Plus, they're naturally sweet, making them a great substitute for desserts. Add blueberries to your morning oatmeal, blend strawberries into a smoothie, or snack on raspberries for a burst of flavor and nutrition. Let's recap the key points. Seniors should avoid processed meats, sugary beverages, and refined white flour products because they increase the risk of heart disease, diabetes, and other chronic conditions. Instead, focus on incorporating leafy greens, fatty fish, and berries into your diet. These superfoods are packed with nutrients that support heart health, brain function, bone strength, and overall vitality. Making these swaps doesn't have to be complicated. Start small. Replace soda with water. Swap white bread for whole grain. Or add a handful of berries to your breakfast. Over time, these changes can add up to significant health benefits. For seniors, eating well isn't just about living longer. It's about living better. Nutrient-dense foods can boost energy, improve mobility, and enhance mental clarity, helping you enjoy your golden years to the fullest. Always consult with a healthcare provider or nutritionist before making major dietary changes, especially if you have chronic conditions or take medications that interact with certain foods. For example, leafy greens can affect blood thinners like warfarin, so personalized advice is key. To wrap up, focus on whole, unprocessed foods and prioritize variety in your diet. By avoiding harmful foods and embracing superfoods, seniors can take control of their health and age with strength and vitality. Stay mindful of what you eat, and your body will thank you for years to come.